If you are currently on Ozempic, Wegovy, or Zepbound, or you have been thinking about it, there is one conversation most physicians are not having with their patients. What happens when you stop? Research is showing that 70% of people who stop a GLP-1 medication regain most of the weight within 18 months. That is not a reason to avoid these medications, but it is a reason to go into them with a much clearer plan than most patients are given. That is what this video is about. I'm Dr. Jeffrey Shukhman. I'm board certified in internal medicine and obesity medicine. I'm a physician at White Olive here in Woodland Hills, California. Weight loss is one of the areas I work on most closely with patients. And the question I hear more than almost any other right now is, what happens when I stop? Will I just gain it all back? Today, I want to give you an honest answer to this question. And more importantly, I want to explain what actually determines whether you keep the weight off. Let's start with the data. Approximately 70% of people who discontinue a GLP-1 medication regain most of the weight within 18 months. That number is not an argument against using these medications. GLP-1 drugs are genuinely effective. For the right patient, they reduce appetite, improve blood sugar, lower cardiovascular risk, and can help people lose meaningful amounts of weight. But that 70% number tells us something important about what these medications do and what they do not do. They change how hungry you feel. They do not change the underlying metabolic environment that causes the weight gain. When I sit down with a new patient and we are talking about weight, I'm not just thinking about calories, I'm thinking about a set of metabolic patterns that work against weight loss and make weight regain almost inevitable if they are not addressed. There are four I look at most closely. Number one is insulin resistance. This is probably the most common and the most underdiagnosed driver of weight gain I see in my practice. When your cells stop responding normally to insulin, your body compensates by producing more of it. And chronically high insulin tells your body to store fat. A GLP-1 medication improves this to some extent, but it does not resolve it. Number two is cortisol. Chronic stress raises cortisol, and chronically elevated cortisol promotes fat storage, particularly visceral fat. It also disrupts sleep. Which brings me to number three, sleep quality. Poor sleep raises hunger hormones. It lowers the hormones that signal fullness, and it makes it significantly harder for your body to regulate weight. Most of my patients who struggle with weight also are struggling with their sleep in some way. These are not separate problems. And lastly, number four is muscle mass. Muscle is metabolically active. The more of it you have, the higher your resting metabolism is. GLP-1 medications can lead to muscle loss alongside fat loss. If you finish a course of medication with less muscle than you started with, your baseline metabolism is lower. That makes maintaining the weight loss significantly harder. None of these four things are fixed by the prescription itself. This is where I think the standard of care falls short for most patients. The medication phase is not just about watching the weight go down, it is a window. And what you do inside that window determines what happens after. Here's how I think about it with my patients. First, we run the right labs, not just the standard panel. I want to see fasting insulin, not just blood sugar. I want to see a full lipid fractionated panel, not just total cholesterol. I want to see inflammatory markers, hormonal patterns, and where possible, a body composition measurement. So we know how much of what we are losing is fat and how much is muscle. Second, we built a resistance training habit during the medication phase. This is not optional for long-term success. The patients who maintain their weight loss are almost universally the ones who built muscle while the appetite suppression was working in their favor. Third, we address the other metabolic factors in parallel: sleep, stress, cortisol, thyroid. And fourth, we talk about the off-ramp before we ever start. What does stopping look like? Most patients have never been asked these questions. Stopping a GLP-1 medication is not a single event, a transition. And like any transition in medicine, it goes better when it is managed deliberately. What I do with patients is essentially build a bridge. Before we reduce the medication, I want to know where they are metabolically. What does their body composition look like now? Where is their insulin sensitivity? Have the underlying patterns that drove the weight gain shifted? We increase monitoring frequency after stopping. This actually is when I see patients more often, not less. The first 6 months after discontinuing a GLP-1 is the highest risk window for regain. And we are honest that for some patients, staying on a lower maintenance dose long-term may be the right answer for them. Obesity is a chronic condition. In most other chronic conditions, we do not expect one course of treatment to solve it permanently. The goal is not to get off the medication as fast as possible. The goal is lasting health. Here's what I want you to take away. GLP-1 medications are a real tool. They work. For many patients, they are the right starting point. But a tool is only as effective as the plan around it. The 70% who regain the weight are not failing. They're simply not getting the support that would make a different outcome possible. The metabolic patterns are still there. The muscle was not built. The monitoring stopped when the prescription ended. That is not a patient problem. That is a care problem. If you're on a GLP-1 medication right now and you have not had this conversation with your doctor, I want you to know that this kind of care does exist. At White Olive, every patient working on weight loss has a plan for what the medication does, what happens during it, and what comes after. We do the labs most physicians do not run. We track body composition, we track metabolic patterns. If that sounds like something you have been looking for, you can book a free 15-minute intro call at whiteolivedpc.com. The link is in the description.